This conference will now be recorded.
Hello everyone, a warm welcome to CM Dental Academy. It's an online dental education platform in the field of dental surgery. We aim at delivering excellent quality online training programs and courses for dental students under the guidance of eminent mentors. The subjects will be covered in all the formats such as live lectures, descriptive notes, MCQs, and Viva Voce questions. So, what are you waiting for? Come, let's begin a journey towards success. In today's class, we'll be discussing about tooth numbering system. Humans have two sets of teeth in their lifetime. The first set of teeth to be seen in the mouth is the primary or the deciduous dentition, which begins to form prenatally, approximately around 14th weeks of intrauterine life. And they are completed postnatally at approximately 3 years of the age. The deciduous dentition remains intact until the child is approximately 6 years of the age. So the total duration of deciduous dentition or the primary dentition in oral cavity is going to be till the 6 years of a child's age. At the same time, the first succedaneous or the permanent tooth begins to emerge into the oral cavity. Those are the first permanent molars. They start erupt into the oral cavity around the 6 years of the age. Simultaneously, the mandibular anterior starts to exfoliate. At this stage, the dentition enters the mixed dentition period because there will be presence of primary or deciduous teeth along with the eruption of the permanent teeth. And this phase is called as the transition phase or the mixed dentition period. It usually lasts from the age of 6 years of child till the 12 years of the age, till the second permanent molar erupts into the oral cavity and there is complete exfoliation of all the deciduous or the primary teeth. Once the permanent teeth erupts into the oral cavity around 12 to 13 years of the age, the permanent dentition continues throughout the life in the oral cavity. The first step in understanding dental anatomy is to learn the nomenclature or the system of names, how to number the tooth, why a particular term is specified to the type of dentition, what does it mean. Likewise, why the term deciduous is used. In this case, the term deciduous means not permanent, which is transitory. The definition of deciduous tooth or milk tooth, which is defined as one of the temporary teeth of a mammal that are replaced by permanent teeth. These are also called as baby tooth or the deciduous tooth. Same, the primary can indicate a first dentition. Usually we use the term primary, secondary, tertiary like that because to explain the sequence of events. Primary is always going to be the first one, the initial phase. It indicates the first dentition, and the term deciduous indicate that the first dentition is not permanent but not unimportant also. So wherever the term deciduous is used, you are now familiar with what it indicates. What does mean the succedaneous? It is used to describe a successor dentition, the dentition which comes after the previous one, and does not suggest permanence. Not always, okay, where the term permanent suggests a permanent dentition. Now you're familiar with the difference between the succedaneous dentition and what is the permanent dentition, because these words are going to be used in dental anatomy and histology very frequently, so I just wanted you all to be familiar with these. All the species which bear the tooth have a specific dental formula. Likewise, human being also have a primary dentition formula and the permanent dentition formula. In case of primary dentition, here I stands for incisors, C for canines, pre for premolars, and M for molars. Primary dentition, 2 incisors, 1 canine, and 2 molars per quadrant. Okay, so on one side of the jaw, when you divide the jaw with on a symmetry, two incisors, upper and lower, one canine, upper and lower, or maxillary and mandible, and two molars. Like this, it is going to be around 10 teeth on one side. So if you consider the entire mouth, it is going to be primary dentition is going to have a 20 teeth. In case of permanent dentation, it is read as two upper and lower incisors, one canine, upper and lower canine, two premolars, maxillary and mandibular, and three maxillary and three mandibular molars. So on one side of the jaw, they constitute around 16 teeth. Entire mouth, when you consider, in case of permanent dentition, there are going to be around 32 teeth. So this is the dental formula for the mammalian teeth. You have to be thorough with this. Some anthropologists use some easy dental notations for them, which will be convenient for them to notify or document whenever they are on the field. So they use DI1, 2, DC, M1, and M2, these notations for the deciduous dentition whenever they're documenting. And in case of permanent dentition, they use I1, 2, C, P1, P2 stands for premolar first, premolar second, first molar, second molar, third molar, notified as M1, M2, and N3. Here DI1 stands for deciduous incisor 1, deciduous incisor 2, DC for deciduous canine, DM1 for deciduous first molar, deciduous second molar. Usually, these are generally limited to anthropological tables because of keyboard incompatibility. So this is just in a practice for the anthropologists to document the any numbering of the tooth numbering systems. To begin with, the universal system of numbering. The universal system of notation for primary dentition uses upper letters for each of the primary two. For example, the maxillary teeth beginning with the right second molar, letters A through J, and for the mandibular teeth, letters K through T, beginning with the left mandibular second molar. The universal system notation for the entire dentition, primary dentition, is in the left diagram. Here you can see in a photograph. So beginning from the right second molar, that is right upper second molar, you have to start as A, then it ends as right upper left upper second molar, and then same side on the left side from the second but lower second molar to the right side second molar. So it is as A to J, right to left, then same from the left side, K to T. This is the universal system of numbering for the primary dentition. In case of permanent dentition, here the letters are no alphabets are not used, but rather than that, here numbers are used. So the same 32 teeth in case of permanent dentition are numbered from number 1 to 32, like starting from the right side, third molar is 1, then left side third molar in the upper jaw as the 16, 1 to 16. On the same side, left third molar is the 17, lower, until the 32, lower right third molar. So this is for the permanent dentition. The symbolic system for the permanent dentition was introduced by Adolf Zsigmondy of Vienna in 1861, and then he modified it for the primary dentition and in 1874. Independently, Palmer also published the symbolic system in 1870. The symbolic system is more often referred to as Palmer notation system in United States and less frequently as Zsigmondy or Palmer notation system. In this system, the arches are divided into quadrants, with the entire dentition being noted like this. Here, in case of the primary dentition, the arches, upper arch and the lower arch are divided into quadrants. These are 1, 2, 3, 4 quadrants, but they are not numbered. Rather than they have been designated, each number is assigned with the letter such as A, B, C, D, E. It depends on if you are referring it for the upper jaw, like upper central incisor, it is written as right central incisor, it is written as A. And in case of lower, it is left central incisor with this sign, it is written, the Zsigmondian Palmer notation. Same for the permanent dentition. Instead of numbers, instead of letters, here numbers are being used. The dental arches are divided into quadrants, 4 quadrants. From central incisors to third molars, numbers have been assigned as 1 to 8, and the same system of notification is written for this also, if you're referring for the upper jaw and the lower jaw. In case of FDI system of tooth numbering, in case of primary teeth, the entire arch is divided into quadrants. In primary dentition, these quadrants have also been numbered, like fifth quadrant, sixth quadrant, seventh quadrant, and eighth quadrant. Here, the fifth quadrant, always the second digit notify the quadrant. So fifth quadrant is the right upper one, and the left upper quadrant is the sixth quadrant. The left lower quadrant is the seventh. So the right lower is the eighth quadrant, and the first digit in this signify the number of the tooth. So 1 is being the central incisor, the 2 being the lateral incisor, 3 for canine, 4 for first molar, and 5 for the second molar. So likewise, in case of permanent dentition, here the quadrants are numbered as 1, 2, 3, and 4. Upper right is first quadrant, upper left is the second, lower left is the third quadrant, lower right is the fourth. The second digit always signify the quadrant to which it belongs, and the first digit always signifies the number of the tooth. Like here 4 is the lower right first premolar. Here in this case 27 stands for upper left second molar. Other than these three important tooth numbering systems, Victor of Denmark in 1981 devised a variant of 8-tooth quadrant system in which he used plus and minus signs to differentiate it, upper and the lower quadrants, and to differentiate between the right and the left quadrants. In other words, +1 indicates the upper left central incisor and 1 indicates the lower right central incisor. Same way, in case of primary teeth, upper right is from 505 plus to 01 plus, and in case of lower left, it is 01 to 05. It depends on the right documenting how it is. Or based on that, we can tell whether this is the which quadrant does it belong and to which jaw it belongs. This system still exists in Denmark. These are the four main tooth numbering systems which are which exist actually. Depending on the convenience, they are referred worldwide. So CM Dental Academy is come up with dental anatomy and histology classes. We conduct online live lectures, provide descriptive notes pertaining to the each chapter at the end of the lectures. It also contains chapter-wise MCQ questions and viva voce questions asked during your exams. Only limited seats per batch will be assigned so that individual attention can be provided. A new batch is going to start from 1st July 2022. So grab the opportunity and register at the earliest. Hurry up. Thank you.